You're fine. Okay, so we are here over at the Foot Whisperer Reflexology Institute with Amy Rinkovich, who is a craniosacral therapist in the area. And this is just us chatting, shooting the breeze, talking about bodywork, industry stuff, things that everybody wants to know but doesn't get the chance to ask experienced therapists in the area. And Amy's been doing this for quite some time. So give us a little bit about kind of your background and how you got started in the industry.
Okay. I've been a craniosacral therapist for about 17 years now. And I came in a little different way because I'm not a massage therapist. I'm actually an RN, and my background is in pediatric nursing mostly. And I had a dear friend, still have a dear friend who's like a mentor to me, and she's a massage therapist. Mm-hmm. And she, because massage therapists are so open, they're constantly adding to their toolbox. She discovered craniosacral therapy, and she just knew it would connect with me. So. Luckily, she was persistent, and I took my first course back in the year in 2000, my craniosacral course. So that's kind of how I got started. It was more just curiosity and wondered what all the fuss was about, and it happened to really resonate and really connect with it. I was always more interested in the preventative side. And I really kind of only saw, for whatever reason, I just saw nursing as an entryway back in the out of college or out of high school. So it's now in the end it blends really well. It's making sense now. But so that's kind of how I came into it, and haven't regretted a minute of it.
Awesome. And you're actually doing like both normal home. Body work practice, but then you also do a lot of work in a very intense hospital setting as well.
Yes.
So give us details about kind of how that works, how that angle of your practice grew, and what that is like compared to like the normal body work setting of table, four walls, like nice quiet environment.
Right. So I kind of have the best of both worlds because. I have my private practice, and it looks, like you just described, where it looks like a massage room, and with a massage table, and I treat people one-on-one, and I love that, and I think I was looking for some community. I wanted to feel, I guess people that work in an office with multiple therapists have that, and I just work alone. So also heard about an integrative program at our local hospital here in Tampa General. And so I approached the doctor that started that, and she had heard of craniosacral. Somebody had introduced the idea, but at the time nobody was actually doing that in the program. And the integrative program there involves just a holistic approach. So we do the hands-on, there's musicians, there's art, there's all those modalities. And she was brave enough to invite me in and learn about craniosacral, and realized it was very safe, and even in a very, very sick population. Yeah. So my day is, I combine them, and so I have my private practice where it's quiet and calm and relatively healthy people, highly functioning enough to be able to drive themselves to a session, and then I go into Tampa General, where it's just a tertiary hospital, it's tertiary care, it's a trauma center. Mm-hmm. So there, people are quite sick, and we've worked literally all over the hospital with every unit, every ailment. And so I kind of think of it as a university. I go there and learn so much, because a little goes a long way. So boy, it's taught me a lot, and so then I can take that back to my practice. And it both goes both ways, but it's amazing how much I've learned by the intensity that a hospital patients bring.
What are some clients that really, or some patients in that environment that really kind of jump front of mind in terms of those like groundbreaking lessons where a client changed your practice and really kind of got you to think a different way?
That's you mean in the hospital particularly?
Yeah.
Yeah. So the hospital, it's again, this is very subtle work, craniosacral therapy, but there, like I said, a little goes a long way in the hospital. So sometimes there we see, and I've witnessed just more kind of dramatic shifts and changes, where in my private practice, and I can talk more about that, it's a little more subtle, you know. But at the hospital, you know, we'll have the experience of, you know, someone's blood pressure just being through the roof, and you know, when they're in ICU, can watch the numbers come down, their oxygenation goes up, their blood pressure comes down, their heart regulates while the hands are on.
Right.
A lot of times then we would hear later, if it doesn't happen then, we would hear later, you know, the nurses may not know exactly what we're doing, but they're, I don't know what you did, but, you know, and of course we're not doing it, we're facilitating the body, and, you know, there's education around that, but it can be pretty dramatic. We've worked with people that are in a coma state, you know, a lot of times they come in with head injury, and they might be medically sedated, or, you know, in a coma. And then once they start to bring them out of that, sometimes people don't wake up right away. And what we've learned with the craniosacral is pretty amazing, that, you know, usually within about 72 hours, again, if the body's ready, and you know, then they'll actually start to wake up. And again, it's more dramatic, more miraculous feeling, you know, in the hospital, because the people are so vulnerable. You know, they could get really sick, or they could get better, you know, pretty fast. So lots of stories like that there, where, you know, we see people a lot of times in the hospital. What I find is the people are really stuck in fight or flight. You know, it's a scary place. It's hard to get better in the hospital because of all the interventions and all of the, you know, invasive procedures, and just the scary, you know, high intensity of it. So what this work can do, if nothing else, is helps reset the nervous system, so they come out of fight or flight, they get more in the parasympathetic nervous system, and then everything starts working better. The meds can actually get where they're supposed to go. Digestion kicks in, you know. So it can reboot in that way, and that's so simple, but it's so important, you know. It's so a lot of times you just kind of see people, you know, land. And take start to exhale, and then you start to see them miraculously change sometimes. And sometimes it's the other way too, you know. Sometimes people are on their way out, you know, they're trying to exit their body, you know, and that's not, you know, sometimes that there can be a stuck place, you know, where they can't really, and again, they can sort of be in the sympathetic sort of loop. And so that can also be, you know, a nice, you know, if they can come out of that sympathetic, and then the body can choose, you know, or the person can choose, you know. So, you know, that's the other extreme, you know. But we have that too. So it's actually lovely to be with somebody, you know, that's trying to exit but can't.
Yeah.
Know? Even though that, you know, that in allopathic medicine, that's not looked out on as a success story, but you know, it's also part of healing, you know. So it's been lovely to learn about that and be invited into that space. Very sacred time.
Another sacred space that you shared before we started is that you're actually working very much in the same area that you studied in nursing in terms of pediatric care. So what are some of the experiences that you've had with craniosacral therapy with the pediatric units, and how do they respond differently as opposed to like general human populations? Right.
On both scale, inpatient and outpatient, pediatric babies and kids, they respond so much more quickly. You know, we all talk about peeling the onion and how we have so many layers of traumas over a lifetime or events or whatever, and babies and kids just don't have the layers, you know. So I was saying earlier, they make us look like heroes, because they kind of just let go of their stuff. They're not attached to it. They want to be free and light and 100% who they are and comfy in their skin, and they haven't gotten comfortable with not being comfy in their skin. Does that make sense?
Yeah.
So it's very rewarding. It's really fun. So we do some work with pediatrics in the hospital, and I work in ICU in the hospital. And then I have probably 60% of my practice is pediatric,
Okay.
my private practice.
Wow.
So yeah, I tell parents, babies, especially newborns and babies, make us look like heroes because they have some layers. It could be in utero positioning, could be the birthing process. And unfortunately, some have had even more intervention, in the NICU and that sort of thing, but not a whole lot, not layers and layers upon layers, so it's really fun. And that's what lights me up. That's what I get excited about, is working with babies and helping the families make a connection. Really is why I get up in the morning. It's not, if I really boil it down, it's if babies have something in the way that they're trying to develop around, and parents are concerned and worried about, there's something wrong with my baby, if we can help the babies let go of that, and we can help parents, feel like that everything's okay, then the connection's there and the bonding's there, and that's what really, that's what's exciting to see, is that when there's a worry or there's something that's not right, it really interferes with bonding. I mean, point blank, And I work with some kids with special needs, and that's a super big challenge for families, and they're just grieving their typical child that that maybe they're still wishing for or pining for, and kind of helping them. Helping the kiddo be as comfortable in their skin as possible, then helps mom and dad, take an exhale, and then they can start to love and appreciate and enjoy the kiddo that's in front of them,
Right.
And it's super challenging. I'm not trying to minimize that at all, but that's really the bottom line.
Yeah.
I think why I get so excited, not just, oh my gosh, no, this baby rolled over that couldn't roll over yesterday. That's exciting, but it's the connection that makes between the family that gets exciting, because then everybody's really connecting.
Yeah.
So I think I answered that.
Yeah, definitely. No, that was a really good answer.
Oh, thank you. There's so many little shifts and changes that happen, with that feel like success stories, but it was pretty subtle too.
Excellent.
Much more subtle. Again, outpatient than inpatient.
Okay.
Inpatient, it's a little goes a long way, and you can see some big shifts.
Excellent. So, one of shifting it back to the other side of your practice in terms of just your bodywork practice, outpatient, really understanding, the different dynamic of somebody who's coming to see you of their own accord versus somebody who may be in a serious health crisis.
Yes.
What are some of the things that you find that are different for those people that walk in, and how do you treat them differently? Or what is that dynamic in terms of craniosacral work look like?
That's a really good question, because sometimes people in the hospital, someone else has maybe made a referral. For one thing, starters, is that it maybe wasn't their idea. They didn't come to it.
Gotcha.
And so and with all of this work, it's still about being given permission,
Right.
And the difference, if somebody drives themselves to the appointment or brings their kid, they've already made that decision. They've already, checked me out and, chosen over all the, maybe options that they had, whether it's modality or individuals or whatever. And so in the hospital, it's a real, it's important that we ask permission. They may not be interested at all, and that's got to be okay. So sometimes we don't do a session. We may get a referral, and they say no, thank you. And if they do, then typically, again, there are some. It's a consumer driven, our industry, and there's more and more educated, more and more people even going in the hospital going, I heard you have integrative, I heard you have craniosacral, I want it. But it's growing, but still a small percentage. Most of the people are don't have any idea. They haven't tried anything, alternative or integrative at all.
Right.
So again, we have to explain it. We have to, establish a rapport, quickly, and then sometimes it's a visit or two before we can actually put hands on. Sometimes they try it and they don't want to do more. Sometimes they try it and we have these amazing, shifts and changes. And so in my private practice, that's already kind of been That's already kind of established. But I find that in general, no matter what, this is really interesting because you think, oh, the hospital is so big and there's so many different referrals, people referring, that you can you really establish your perfect clientele or your perfect practice? And I think what I've learned through my private practice is that it's helpful for me to figure out who's my perfect client and who responds best to what, who wants what I have to give,
right.
And also what I've learned is that people that are really ready to do their work, I work best with. We can kind of hit the ground running, and it doesn't mean that there's not somebody for people who aren't quite there. But and I find that true in the hospital too, and I find with little kids most of the time they're ready. Sometimes parents not so much, and sometimes that's their hurdle. Is get their parents on board.
Right.
But so they kind of come ready to work. So that makes it very different from the hospital versus my private client. Speaking of that too, what can help parents get on board too, I offer sessions for the families, and ideally the whole family's getting treated. If mom and dad have restrictions and are very tight, the baby knows about it and feels it,
right.
And vice versa. So I love to work with moms. Sometimes when I can work with the mom or dad, that makes them that much more open for us to work with the baby. So a lot of times little kids will walk a whole family into receiving the work. And it can go the other way. Usually it's the woman, it's the
right.
the mom. And then, if over time, we'll just see all the other family members trickle in, which is just my dream, is to work with the family unit. Again, it can to really helps bring that whole bond together. But that's kind of what I've noticed about myself, and who I work best with are people that are, they're pretty ready. They're, either they're really tired of being in pain, or they just want to be lighter. They want to feel more comfortable in their body, and they want to live differently. And so when those people find me, it's exciting.
We talked a little bit about this right before we started the Facebook Live, is the integration of different modalities based on what you feel the person needs at that time. And the first question that I wanted to ask in regards to that is, what are your thoughts, or what are your practices in regards to assessment? How do you actually assess from a cranial standpoint what somebody needs to do that would truly benefit their process? And then what are some of your go-to things that you do in order to suggest, maybe you should try XYZ to keep the session moving forward?
So if I'm going to see somebody consecutively, what are they doing in addition to craniosacral?
Yeah, that, and then during the session, what do you see often that palpation-wise, or in the actual cranial flow, what suggests to you that somebody might have a dehydration issue, or from an assessment standpoint, what does that look like?
Okay, so it varies. For one thing, with craniosacral and I think all of these modalities, it's about treating what we find. Treating what we find, and assessment's a big part of it. The beginning of the session, the end of the session, and then the beginning of the next session. And it, there's no cookbook. There's no, when I find this, it means this. Or if somebody calls me and said, I'm coming in with migraines, I don't have any idea what we're going to do.
Gotcha.
Because the body, we treat what we find, basically. And that person with migraines, the issue may be some tension way down in the sacrum, because of a fall they had 30 years ago. Mm-hmm. We may never know why. But so that is important, so that that we don't get kind of any sort of idea or protocol.
Gotcha.
There are definitely techniques, and there's things that we learn that can help the body move along, but we may not do that. And you may not do that in a certain order.
Right.
It depends on kind of where the body guides us. But I do find that if I sometimes the flow within the cerebral spinal fluid, even within the lymph fluid, feels a little sticky. Sometimes we can do the same work day in and day out until they hydrate, or maybe there's some detoxing that needs to happen. You know, maybe every time we work, it just feels like the bowel is just not flowing, or the liver is, you know, is maybe congested. And I'm not a diagnostician. I don't make recommendations for people to take certain herbs or, you know, things like that. But I can let them know what I'm feeling, and you know, and then they go from there. Hydration's big. Hydration, you know, cerebrospinal fluid, especially with the elderly, a lot of times the fluid around the brain is just feels sluggish. And so I do talk a lot about hydration to people, and then integrating the work once the body makes a shift. I was telling you earlier, it just feels so almost irresponsible if I don't mention some kind of movement. And yoga I've found to be just the best way to integrate the craniosacral work. So the craniosacral work happens in a very passive, you know, the body's laying there receiving, and also very much participating. And then in order to really reboot the nervous system, because the body's dynamic, it feels like movement is really necessary. And I found personally that yoga helps that integrate. So I feel like sometimes I tell people, you know, ask them if they go to yoga. I may tell them a specific, you know, couple of stretches that might be helpful. But bottom line, trying to empower, you know, so that it's not just about getting on tables and having this passive treatment. It's about now what can I do to help this really integrate.
Yeah.
And take the show on the road, you know. And then what I find, it's really fun. I see people, even just a session where stuff gets moving that's been stuck, you know, whether it's, you know, cerebrospinal fluid or blood flow. Once the body kind of gets through a restriction, you'll start to see the person either remember things that they used to do and kind of go, oh yeah, I used to meditate, or new things come to them. So then the world starts opening up a little bit, and they do some self-discovery. But I think it's helpful if we, you know, give them some ideas, because they may feel they've got this whole new body that feels really different and better and lighter, but they don't have the skills or the knowledge of, you know, how to maintain that. So yoga's a biggie, you know, and then I may suggest, you know, different things with hydration and detoxing, and then see where they go with it. You know, they see where they discover, but give them that little hint of what's helped me personally is always a good way to start.
Awesome. You used a really important word, I think, a couple of minutes ago, the word empower. How do you feel like craniosacral work has empowered you as a body worker, and what do you think, especially for new body workers that are just coming onto the scene, what do you think diving into something like a craniosacral practice as like right out of the gate, first true modality that they study, what do you think that they would get from that, as well as what you received from it kind of first starting out?
Right. Well, and I think it starts with me receiving the work, you know, personally.
That's a big one.
And I, you know, that's a whole nother little tangent we can cover too, or that I feel so important. I feel like it's also, we're body workers. Body workers must get body work. But for me to really understand craniosacral, I had to receive it. And what I discovered when I received my very first session is I felt some shifts and some movement that I had never felt before. And the person working with me gave that back to me and said, you know, that's you. That's your body. Maybe there was a blockage there, and now you feel flow where you hadn't felt it before. And so that's empowering all in of itself. So once I felt that, and more and more and more, and then start, like we said, peeling the layers and getting rid of restrictions, it became easier and easier and funner to be, you know, in the body and on the planet. Yeah. It's a super empowering work, because we're working with the body's own healing mechanism, and we're facilitating that. So anything that happens, no matter what intervention, whether it's, you know, medication or surgery or whatever, my feeling is that it's facilitating that body's own mechanism for righting itself. So if I can hand that back and say, you know, because I think it's our culture is, especially in Western medicine, is fix it. You know, someone else has to fix it. and I go somewhere to be fixed. And the truth is, that we're actually, the common denominator with all that is the body that's, going from visit to visit, to office. And when that kicks in, that connection between, oh, wait a second, I'm my own best healer, and I'm on the job 24/7. And
right.
Dr. Upledger, that pioneered this work, called it an inner physician. That's always in there, always taking inventory, always checking to see what needs help and what doesn't. So I think the work in and of itself is empowering, but I didn't get that till I got it on the inside. And then now I'm able to, help people reconnect. I think we're really reconnecting with ourselves, when we feel those shifts and changes and feel the inner physician or the healing mechanism kicking back in, because sometimes it gets so blocked and restricted that we get there's just too much, just kind of too much in the way. But when we start to remove some of the blockages, the body does naturally know how to go about healing itself. And then so then what I'll tell people is, just because you get off the table doesn't mean you stop working. We
right.
help jumpstart this process, and the rest, that's where my part starts and stops. And you're off and running, and we'll see where you are when we see you next. And everything in between is your body having done its work. So I think that's one of the first words that came to me, is that I felt very empowered, like I had some control back. And a lot of times people find craniosacral and will come to me and it's last ditch. They literally have exhausted everything else. So it's a really nice feeling to go, okay, I actually feel better, and I feel like my body's doing it, and I actually have some control, where maybe they felt like they just didn't have. They were just, back against the wall with chronic pain.
Which is a really powerful experience for new therapists to really kind of dive into, is the potential that the body holds within. And I can imagine, especially just starting out, not really, we had talked about this before, not really getting from a left brain perspective, kind of what, the anatomy, the physiology, how everything works together, but not really understanding how the body heals and how the body, turns into different states of dysfunction, and understanding from a holistic perspective like craniosacral offers, how easy that is to truly correct
right.
with very minimal effort and just a lot of listening and receptivity.
And following. And I think the sooner the better, you know. I didn't come to craniosacral after I had a lot of other modalities in my toolbox. That was my eye-opening, first modality. But I can only imagine that the sooner we can get that in our hands, what you just described very beautifully, is then the better therapists we're going to be from the very beginning. And then again, we don't get caught up in the people coming to us to be fixed, and get caught up into even the idea that we're even able to do that. And because that's exhausting, and it actually doesn't work, So if the sooner, people right out of blocks, right out of school can get that, I want to go to those therapists.
Right, seriously.
That's the kind of therapist I tell people that, people that are looking for modalities. Let's say they're moving to a new city and they want another craniosacral. I will say, look at their experience. But if you can find a way to find out how much work they receive, then it tells you a lot about them. Because it's I haven't figured out any other way. And Dr. Upledger will even say, we can only take people as far as we've gone. And so if we haven't done the internal work, then how can we facilitate as well? Doesn't mean we have to have the same life experience and the same injuries, or even be you've heard of the wounded healer. Not I don't believe we have to have that, but if we do our own internal work, then we're able to help people facilitate them through there. So that went back to get on tables ourselves.
Yeah, that's and I'd like to continue down that train. One of the things that I have noticed over the course of going to other places and teaching and getting a feel for, where the massage community is at locally in Tampa Bay, I see a lot of that wounded healer. I see a lot of the body workers that are broken, and they're burnt out, and they've been taught the wrong things, they've been practicing the wrong ways. So what do you feel, besides, learning a modality like craniosacral therapy and just overall methods of self-care, what things do you think that the bodywork industry should be focusing on instead of what they're focusing on now in terms of just even something like stuff that's on their services menu or just the mindset?
And, maybe it goes back to education, which I'm not as much more familiar with, kind of but I think it's up to us, like we get our foundation. Mine was in nursing. It certainly didn't empower.
Right.
I think I told you earlier I had to kind
it's
of
the
unlearn.
opposite, yeah.
And Western allopathic medicine is very much illness model. And what I've learned and I'm leaning towards now is wellness model. It's a completely different approach. So we have our starting point, and then, I think it's, I think we're probably, people are looking for something different, or, and they may take their own pain in their own body as a body worker before they're like, okay, got to do something different.
Yeah.
And it would be lovely if we didn't have to go down that path. But sometimes it's something that nudges us, and then these other modalities are there. And I know a lot of massage therapists that feel over the years that their body starts to really, it takes a toll on them.
Yeah.
And adding other modalities that are not as physically intensive not only will heal their body, but then they can offer up. And then maybe it makes it less necessary to go so deep or to feel like they have to use so much force that maybe creates the injuries in the first place.
That's very interesting.
So now that I know what I know about how light touch can be so powerful and go quite deep, I wonder, that if sometimes if the combination, or looking into reflexology or craniosacral that have such a big impact, and they can help move those roadblocks without a lot of force. Right. But hopefully people will start to hear more and more about the different ways, so that they don't get caught up in that. And I think it's a lot of it's intention. If we feel like somebody's coming into our practice, they're in pain, they want to leave out of pain, and it's up to us, then that's exhausting all in itself, right? First of all, we're taking way more responsibility than maybe that pain there is
for a reason.
Exactly.
Yep.
And until that message and that communication has been validated, maybe the pain needs to stay. The body may not be as protected or safe without it. So I think I just, it would be lovely to have this. I think it's so great that you're doing this work and interviews, because we get the message out more and more. If people don't know about it, then they don't know to be any different. But that starting out, thinking that we have to make people feel better. I had one teacher that said we can't care if people get better, and that really shocked me. I had to really sit with that.
Yeah. And
I think the bottom line is there. If I'm neutral, and that's another big lesson that I've learned, and the hospitals helped me a lot with, I think I'm neutral, and, when a little goes a long way. You see with these really sick patients that, I have to back up and really, really find neutral. But if we are, then we are just there and we're facilitating, and the body will do what it will with it. Right. And then we don't have an investment of the outcome,
True.
Whether or not they're in pain or not in pain, or, is it really any of our business, Ultimately, though, what I find, if people doing their work and their internal work, they do feel they are in less pain. They tend to go, their medications they need less of, and with their doctors they start to work out that they need less and less intervention, less and less high dosages of medicine, and they are in less pain. Yeah. Luckily, but how they get there and when they get there has to actually be none of my business. Right. Which was a biggie,
That's huge. I think both from a therapist standpoint and from a client standpoint, it breaks a lot of new therapists, really, because I think that most body workers get into the field of body work in order to save the world, and that's really with heart totally open, just ready and
pure intention.
Exactly, and without the ability to respect the necessary struggle, both from a body worker standpoint, but also from a client standpoint.
Right.
They have to go through their process just like we do, and we can't feel obligated to knock them off their path or to derail them when they might be so close to finding the answer that they actually need.
Right.
And sometimes it's just planting the seed and not really needing to feel the interventionist's mindset, like so many body workers tend to take on.
Yes, and in the end, it's a heavy load to carry,
Yes.
and it's just too much. But also not having to get credit, you know.
True.
Because sometimes I'll hear they'll go, oh, you know, Amy, I'm doing acupuncture,
Mm-hmm.
I'm doing craniosacral, I started, you know, changing my diet, I set some boundaries in relationships. They'll list everything they're doing, and they'll go, but I don't know what's helping.
Mm-hmm.
And I said, well, it's all working. Keep doing what you're doing. You're taking good care of yourself. You're figuring out how to get better. And it's never just one thing that creates something. It's never just one thing that helps it. So, and that's nice to, you know, we're also handing that back to them. You know what? You're doing this. You're seeking all these different things. You're getting better. And so you get the credit. You know?
Very therapist as mirror.
Yes, yes. And a lot of times I will find that people really have a hard time accepting that themselves. They'll go, well, you did this and you did that.
Yeah.
And when they can, it's really a good day, you know. But I'm careful not to take that because it's a burden.
Right.
It's a burden.
True.
You know, it's a selfish reason.
There are many clients that have come to see me, and what I find, you had talked about this a little bit as well, about kind of that will, that drive to get better, like people who are ready to do the work. Those are the people that come in and say, Sam, you cured me of cancer. I'm like, oh, no. Instead, it's like, you know, they were already so close. They were already there. They were already like, it's that hunger and that drive. And, you know, we're just very much the last stop on that journey to really sealing the deal with changing the lifestyle patterns.
Right,
And so,
or maybe the first stop. And then and then where they go. And I think that's the most rewarding, is seeing people shift. And sometimes we may be the one thing they do differently that they haven't ever done in their whole life. So we don't even know, you know, the impact. But it's fun to start to see them shift and change in their lives. And I personally experienced that. So, you know, I get lit up when I see people that are more comfortable and happier and more content and less, you know, they don't have to understand as much. They just go with the flow.
Exactly.
And you can start to see that they may make big to life changes in, you know, career and that sort of thing, or not. It may look very much similar on the outside, but you know, so sometimes we can be at the beginning of that, and but it's really nice to see that when they reach, you know, when they come out of something big like cancer.
What are let's talk about kind of levels of clientele. So when clientele, or even people who are in like a more urgent situation, like in a hospital setting, when those people have received body work, they have, you know, a lot of body awareness, they've developed a lot of self-care, yet they've hit their wall.
Right.
How do you find that what is the dialogue like between that person and somebody who maybe this is like first stop, like no preventative maintenance regimen whatsoever, they have no idea what else is out there, like what is the dialogue versus client level?
Sort of an educated consumer already, or someone that's already, that's a really good question. I think that we meet them where they are, right? And including the vocabulary and the language, you know. That
they understand.
Exactly.
Yeah.
So you know, we may just say, you know, this is going to help your blood flow to where your wound is, and it can maybe help you heal faster, and that's enough. But so we start where they are, and if words they don't get, or not even words they don't get, but just conceptually not where they are, then we just kind of back up until we can connect, and then we go further. That may be all we need to say, and they're ready and they're in. But the more their questions then will take us to how much in depth they want to know. And some people will say, especially in the hospital, they can be pretty leery of just hands-on, right? And they may say, what's your intention?
Right.
And they may talk about energy, and we call it the E word. Some people, you use the word energy, that's just a real not safe word. Yeah. And so some people will start with that word and we'll go, okay, you want to talk, that's the terminology you want, because we're completely an electrical panel, our whole body, there is energy flowing, there's, so when people say, are you working with energy? I'm like, well, the body's made up of all that.
Exactly.
And we work with whatever comes, whatever blocks, right? So if there's energy blockage, yes, but some people, you wouldn't start with that word because it's very off-putting. And so we meet with people where they are spiritually, we meet people where they are, mentally, emotionally, and then physically. So that's kind of no recipe, no cookbook.
Right.
You just meet them where they are.
Social skills.
Yeah.
Last thing that I really wanted to hit home with is during our conversation before this, we talked about other practitioners in the area that we, both know and kind of get along with, and we have like minds with. And shout out to Dr. Chakshi over at Tampa General Hospital, which is who we've been referencing, the physician who runs the integrative medicine program there. She is truly a pioneer in the world of wellness here locally in Tampa Bay. But we had talked about other practitioners and how it's so striking to me how whatever modality you choose to practice, it's the same words, the same language, the same general concept. So what is your experience of that? And if there were kind of general messages that you could send out to the bodywork world, like what would those core concepts be that they can take and implement into their practice?
I think that's a great point. Good question. I really feel like there's a lot of these modalities have been around for thousands and thousands of years, and they may have different names. They may have different. But I look at all modalities as an art form, and so we have little different mediums, right? So craniosacral is working with soft tissue and with the container to the nervous system, and that is our modality. So maybe we're soft tissue body workers. Chiropractors are working more with bone. You're working with meridians and energy flow and electricity and points in the body. But it's all bottom line is there's a blockage. Can we help free it up? And can that then facilitate the body's own healing mechanism? And it's as simple as that. And one thing that I love about craniosacral is that it's from the beginning of our education, it's not a one-stop shop. It's never, taught that this is all you need. In fact, it's the other way around. This work may help other modalities work more easily because we're taking pressure off the central nervous system. Yeah. But all modalities have a place. Yeah. And they marry well, and in the right combination and the right timing, it can be exactly what the body needs to So to support our not be territorial, not feel like or project that at all, I think is very important to bring the community together. And then again, we're empowering individuals to go, so tell me about your other body workers. I'd like to tell other clients, and then they start to build their own team. And it takes a team to keep this body comfortable. Yeah. I don't just see craniosacral therapists. I have acupuncturist and craniosacral and massage, and I would love to do more reflexology and a chiropractor. And I've learned by bringing this team of people together for myself that I kind of know when I need what, and so if we can reflect that back to our clients and again empower them and go, you'll know when you need what, and we'll guide you along the way. Leading people to other modalities. And because we're all trying to get to the same place or help facilitate that body back to equilibrium. Something's out of balance, something's blocked, and we just have different doorways that we're going in. Is how I see it. Yeah. And so that therefore they all marry, and then it's just really nice to have, like you said, like-minded, and find those people in your community where basically that support what I'm saying. That basically if whatever they're doing if they're, if they're empowering and they see themselves as, not fixing and taking all the credit, all that sort of thing, that can be, not necessarily somebody that resonates, with how I receive work. So that's kind of how I see the whole community. And I always tell people, no matter where you live, it's a little tiny town or whatever, most likely your body workers are nearby. And you find one, then you'll find the rest.
Yes.
If you resonate with one, then they will lead you to the rest, and that's lovely. That you're reaching out, and that we have this, we have this little not little, a nice group in our area, and I believe that's everywhere. I hear about people flying all over to. And I think there's some extreme cases where that's necessary, but I really believe our people, our body workers are nearby.
Yeah, agreed.
It may not be exactly what we thought we were looking for, but
definitely what's needed.
Yeah.
Cool.
So thank you.
No problem. Thank you. Thank you for taking time for our interview today.
Yay.
And if you want to connect with Amy at all, what is your website and
That's a good place to start. Amy Rinkovich, and my last name is Rinke, V as in Victory, ICH.com.
Perfect. Awesome. And this has been another video brought to you by the Foot Whisperer Reflexology Institute. Catch us at the FSMTA convention at the end of June. This will be one of the videos that will be playing on the screens, and we will catch you guys on the flip side with another interview.